The Victorian Government is investing $605 million to redevelop and expand the Frankston Hospital that will transform services at the hospital to ensure that local families can access world-class healthcare facilities closer to home. This morning's webinar will introduce and connect you to Exemplar Health, who are one of 3 consortiums currently tendering for this project, and some of the potential opportunities that may be available to local industry. Good morning, ladies and gentlemen. My name is Andrew Bradley, and I am the Manager of Industry Engagement with ICN Victoria. And it gives me great pleasure to welcome you this morning to this webinar. I would like to start today's proceedings by acknowledging the traditional owners on the land on which we are all meeting and pay my respects to their elders past, present and emerging, as well as all Aboriginal and Torres Strait Islander people who are with us this morning. During this morning's webinar, you will hear from Sarah Neves from Capella Capital, Jackie Saltry and Dim Jansev from Lend-Lease Building, Brian Finnegan from ICN on social procurement, Chris Mansfield from Honeywell, and Chris will be followed by Bren Gray from the Compass Group. I will then provide a quick update on ICN activities, which will be followed by a Q&A session with all of the presenters. For the live Q&A session, please submit your questions via the raised hand icon on the platform, and these can be submitted at any time throughout the session. Also, please note any questions that we don't get to during this webinar will be responded to and placed on the Exemplar Health Frankston Hospital dedicated ICN Gateway page in the next few days. Should you experience any technical difficulties during the session, please call 1-800-733-416 and the operator will sort that out for you. We hope you enjoy today's webinar, and I'd now like to introduce Sarah Neves from Capella Capital.
Good afternoon, everybody. My name is Sarah Neves. I am a director at Capella Capital and the Exemplar Health Project Director. So what and who are Exemplar Health? Exemplar Health is one of 3 consortia that are bidding for the Frankston Hospital Redevelopment Project. Tenders are due for the project in September this year, and contract award is scheduled for early 2022. The Exemplar Health team comprises Capella Capital, an infrastructure investor, developer and manager. That's who I work for. Lend-Lease Building, who is our design and construction contractor. Honeywell, who is our facilities management contractor, and Compass, who is our soft services contractor, so responsible for cleaning, grounds and garden and security services. We're also supported by a first-class design consultant team. We have Bates Mark, who are our architects for the project, Urbis, who are our landscape design and master planners, Conrad Gargett, who are our health planners, and Waterman and WSP are also key consultants for various building services. What are we doing here today? So the purpose of this briefing is threefold: to provide an overview of the project, for you to meet the Exemplar Health team, and most importantly, to encourage you to get involved in the project and let you know how to register your interest. What is the project? So many of you will know about the project from various government announcements. The Frankston Hospital Redevelopment Project will be Frankston's largest ever government-funded project. It is being delivered as a public-private partnership project, which means simply, among other things, that we will stay on and provide services to the redeveloped hospital beyond construction for about 25 years. $605 million is estimated to be spent across construction, with additional maintenance and services spending over a 25-year operating term. The project will include the construction of a new acute services tower on the tennis courts adjacent to the existing hospital, and works better necessary to integrate the entire campus. The project is forecast to create thousands of jobs. The tender conditions require us to focus on building a local industry workforce and creating local employment, so the opportunity for local industry is significant. The Victorian Health Building Authority website has more detail about the project for those who are interested, including a breakdown of the additional points of care. In terms of the Exemplar Health team, as I mentioned earlier, it comprises Capella Capital, Lend-Lease, Honeywell and Compass. In terms of Capella's experience, we have delivered more than $20 billion worth of infrastructure in the last 10 years. In relation to our hospital experience specifically, we've most recently developed the Bendigo Hospital project and the Sunshine Coast University Hospital in Queensland. We're also currently delivering the Melbourne Metro project. If I was you, I would want to know, why is this project important to Exemplar Health beyond being a project which aligns nicely with our respective CVs? Leaving aside obvious reasons, as team members, we are becoming increasingly connected to Frankston and aware of its fantastic sense of community. We understand how important this project is to revitalising the local economy and jobs and to making things better for the locals more generally. Many in the Frankston community talk about this project being transformational. This is not a typical project in terms of its potential impact on our community. It's much, much bigger than that. Put simply, we want to be part of improving health, wellness and economic outcomes for Frankston and the Mornington Peninsula communities. Thank you. I'll now hand over to my colleague Dim from Lendlease.
Good morning all, and thank you Sarah for the introduction. As Sarah mentioned, my name is Dim Jansev and I'm a Senior Construction Manager with Lendlease Building, part of the overall Exemplar Health Consortia bidding to deliver the Frankston Hospital redevelopment. For those not familiar with Lendlease, I will provide a bit of a brief introduction to who we are. We are a global property and construction business. However, importantly, we are Australian owned and we do have a significant presence here in Victoria, in particular when it comes to health projects. Sarah mentioned some of the recent partnerships with Capella Capital, for example, Bendigo Hospital redevelopment. But beyond that, we've also got further health experience in the region. Most recently, we just delivered the Joan Kerner Women's and Children's Hospital in Sunshine, the Shepparton Hospital redevelopment, Monash Children's Hospital, Box Hill Hospital, and if we go back some 8-9 years ago, the Royal Children's Hospital here in Parfield, which I was very lucky to be a part of. We, as a business, have a dedicated health strategic business unit, and we have a vast pool of resources that we can draw on when it comes to the very technical nature, when it comes to the design and construct of complex, large-scale hospital redevelopment projects. And we've also got some significant interstate experience. We're currently delivering the Tweed Valley Hospital and the Prince of Wales Hospital at Randwick. And if we go back just a couple of years ago, we recently delivered the Gold Coast University Hospital, the Sunshine Coast University Hospital and the Gold Coast University Hospital. So as I mentioned, significant health experience both here in Victoria and also nationally. We're here today, obviously, to talk about local industry engagement and in collaboration with ICN, talk about what are some of the opportunities for local industry to engage with us during this bid phase and hopefully translate that into opportunities should we be successful. Now, my colleague Jackie Saltrey will speak after me and talk in detail about what the local industry and government policy specific to this project entails and how some of those targets will correlate into opportunities during the design and construction phase. A little bit about the timeline, and Sarah mentioned the bids close in September and a successful bidder will be awarded late this year. Construction will be due to commence in the early to mid part of next year, and the construction program will be around the circa 3 to 3.5 years. We're still obviously working through our design and program submissions. So there will be further opportunities to engage with a successful bidder during that process. What are we looking for out of this, out of today's session? I guess we want to really understand the opportunities and work closely with local businesses to really open doors to potential packages and works that could be delivered by a local business. As I mentioned earlier, we are an Australian-owned property and construction business, and we think it's very important and we very much value the engagement of local Australian businesses wherever we possibly can to deliver the works. Some of those works could vary in nature from the early civil excavation groundworks packages, in-ground services, through to our potential concrete structure, structural steel packages, and into the fit-out and finishes of a hospital. So look, as I mentioned, my colleague Jackie will now talk a little bit about the opportunities and the social procurement framework in greater detail. And I welcome some questions towards the end of these presentations where we can engage much further and talk about some of those opportunities in greater detail. Thank you.
Good morning, everyone. I'm Jackie Saltry. I'm the Regional Social Sustainability Manager at Lendlease and responsible for leading the government policy response for the Frankston Hospital bid. Firstly, I'd like to thank ICN for the opportunity to present today. So many of you would already be familiar with the policy and the role that it plays on major government projects. There are a number of policies that are essentially all interlinked. There's the Local Jobs First policy that comprises of the Victorian Industry Participation Policy, as well as the Major Project Skills Guarantee. There's also the Victorian Social Procurement Framework. And whilst the government has set a number of targets that need to be achieved through the delivery and operation of the project, we are committed to generating social value and achieving meaningful and sustainable social outcomes for the Frankston and Mornington community. So we're required to deliver a local industry development plan that articulates the opportunities for local procurement and local employment. So the government defines local as Australia and New Zealand. However, we would like to explore opportunities within the Southeast Corridor and the Frankston region as well. So the government has set targets of 91% of the D&C phase as local content, 80% of the operational activities, and 40% for FF&E procurement. Within the LIDP sits the Major Project Skills Guarantee. So this is about providing opportunities for apprentices, trainees, and cadets. And the government has set a target of a minimum of 10% of the estimated labour hours to be performed by apprentices, trainees, and cadets. So this could be your existing workforce, but also providing opportunities for new positions for apprentices, trainees, and cadets. The government has also requested that we respond to the social procurement and workforce development opportunities. So they've set a target of 1.5% of the D&C price. So this includes expenditure across both the development and operational phase. A minimum of 1% of the D&C price to be spent on Victorian Aboriginal businesses. So that sits within the 1.5% target articulated in the first bullet point. And then there's also providing opportunities for Aboriginal employment. So that's 2% of the D&C or operational phase of the workforce. And also to provide opportunities for priority cohorts. In the next slide, I'll explain who those priority cohorts are. So those opportunities for priority cohorts includes procurement from social enterprises, but also employment opportunities as well. And then there's opportunities for public tenants. So the government has set a target, a minimum of 6 public tenants to be employed on this project. So the Victorian government's social procurement framework sets a number of key priority areas and priority cohorts. So the objective of the social procurement framework is essentially to build a fair and inclusive, sustainable Victoria. And this is done via the procurement process and also providing employment and training opportunities for the priority cohorts. So we're committed to delivering these targets, but also looking for opportunities to exceed where possible. And we don't want to do this just because we have to, but because it's the right thing to do as well. So the procurement framework asks us to provide opportunities for Victorian Aboriginal people. So that is a minimum expenditure of 1.5% of 1% of the D&C price on Aboriginal businesses, but also employment opportunities for Aboriginal Victorians, and this is set at 2%. So opportunities for Victorians with a disability. So this is about purchasing from social enterprises or Australian disability enterprises, but also looking at opportunities for employment of people with a disability as well. Then there's women's equality and safety. So this is about gender equitable business practices and employment of women in non-traditional trades or professions. And then it's about supporting safe and fair workplaces. So this is about purchasing from suppliers who comply with industrial relations laws and promote secure employment. Sustainable procurement objectives is about the use of sustainable resources. It's about managing waste and pollution, the adoption of sustainable business practices, and minimising greenhouse gas emissions. And then there's the Big Build integrated model for skills and training. So this is a collaborative model with the Department of Education and Training. And this is about integrating and embedding training and employment activities, improving the pipeline of skilled workers, attracting and retaining talent, but also it's about supporting the delivery of the government policy as well. So we will work with the Department of Education and Training to deliver on our policies. So within all of these policies, it will be Exemplar Health will be looking what we can procure directly, who we can employ directly, but then we will also look to pass that down our supply chain to our subcontractors, our tier ones, our tier twos, etc. So we will be looking for people to participate in this project who are committed to delivering on these targets, looking at where we can exceed those targets, but supporting it so that we actually can leave a great social legacy for the Frankston region. So thank you for your time, and I'll now hand over to the next speaker. Thank you.
Thank you, Sarah, Jackie and Dim, for a fantastic overview of Exemplar Health, the project itself, as well as some of the targets and commitments that you need to reach to be a compliant tender. As Jackie mentioned, the social procurement framework is an important mechanism for social benefit. And to expand on this theme, I would like to introduce Brian Finnegan, who is ICN's Senior Social Procurement Advisor.
Thanks, Andrew, and good morning, everybody, and welcome to this presentation about the Frankston Hospital upgrade. My name is Brian. I am the Senior Social Procurement Advisor for ICN Victoria, and I thought I'd just kind of appraise you of a few kind of areas about social procurement, because I know it's an area that a lot of commercial businesses and SMEs and head contractors are still trying to work around in terms of their commitments. What is social procurement? The social procurement framework, or as in its long form, the social and sustainable social procurement framework, was launched by Victorian Government in September 2018. What is it? It is Victorian Government policy, and its main aim is by using its spending power and its procurement power is looking to support Victorians that are socially and financially disadvantaged, and communities through the direct employment or indirectly by supporting social purpose enterprises and Aboriginal businesses. I'll come to that in a bit more detail in a minute. Why is it important to you? It basically, for all Victorian state government contracts, there will be a social procurement part of that tendering process as well. So it's very, very important for all businesses to be able to understand it in some detail and to be able to address their strategies as they come to tender, either to the state agencies or to head contractors themselves. The government tenders are up for projects are looking for social procurement value as a point of difference and as assisting as part of this process to diversify the supply chains and in turn increase competition as well. And it also promotes social responsible business practices. 4 key elements to social procurement framework as it stands that you might want to just get your head around just to start with. What it's seeking to address in 10 objectives is 4 particular things. Either direct employment opportunities for people who identify as Aboriginal or Torres Strait Islander, people with a disability, other disadvantaged people in the community as well, and that's a wide range of cohorts, and that would include mature age workers, retrenched workers, vulnerable at-risk young people, people coming out of the corrections system, victims of family violence, and the list goes on as well. So disadvantage is not necessarily disability. Secondly, it seeks to engage your engagement of social enterprises, Australian disability enterprises, and Aboriginal business that will create indirect employment opportunities as well. And that's been rather successful over the 2.5 years that this procurement framework has been out, particularly on the major infrastructure projects as well. Thirdly, and this is a key priority for Victorian government at the moment, particularly in the pandemic, is gender equity. A lot of women and young people were far more susceptible to losing their jobs last year, particularly through industries like hospitality and retail. And the fourth one as well, and it's an important one that gets missed a lot, is there are a number of objectives around environmental sustainability, recycling and circular economies, and robust kind of resilience to climate change as well. So what can we do for you? So ICN Victoria, myself and members of our team can assist you with reviewing your strategy as stands. I think what a common theme is that a lot of businesses don't believe that they're doing anything in this space, and then quite pleasantly surprised to find that they're already engaging in one way, shape or another. So my resource is a free resource, and it can assist you in shaping your tender documentation and also your strategy as stands going into the future. It'll allow you to understand your social and sustainability capacity, and I think that's really important going forward, not just for this project, for many others as well. We can facilitate opportunities for competitive, social, sustainable suppliers. So we can be a point of reference if you're looking to be able to try to engage with the likes of social traders, Kinaway, social enterprises and Aboriginal business as well. And very importantly as well, and this is a key consideration, we have measuring tools that can allow you as a head contractor and subcontractor to report your achievements in real time as well. So you basically have that system at your disposal as well. That's it from me. Please feel free to reach out to me or industry advisors or any member of the ICN team to be able to start or continue a dialogue around social procurement as well as the local jobs first commitments as well. Thanks, and I'll pass you back to Andrew.
Thank you, Brian, for providing some further insights into social procurement. And I encourage all of you to make contact with Brian if you would like any further assistance in this sector. Our next speaker is Chris Mansfield from Honeywell, who will update you on their role within the bid team.
Hello, my name is Chris Mansfield. I'm the Asia Pacific subcontract category lead for Honeywell, also focusing on social procurement. I wanted to introduce not just myself this afternoon, but also Honeywell, as I appreciate not everyone knows what we do. In essence, we invent and commercialize technologies that address some of the world's most critical challenges right now around energy, safety and security, productivity and global urbanization. We operate in approximately 70 countries and employ over 100,000 employees. Current revenue is about $40 billion US. We manage our business operations through 5 different business organizations: aerospace, building technologies, our safety and productivity solutions, performance materials and technologies, and connected enterprise. We have a holistic view on working to support hospitals such as Frankston. And as you can see from the diagram, that's pretty complex in terms of its delivery. But what I wanted to do was basically focus on the holistic approach we have, focusing on service and maintenance, CCTV and video surveillance, access control, and heating and ventilation and air conditioning. What we bring to the consortium is an expertise in technology solutions to create smarter buildings, whether they be corrections facilities, stadia, commercial towers, hospitals, or even opera theatres. Specifically, these services will cover technology infrastructure, building management systems, and security services. In a hospital environment, these critical systems need to be maintained at the highest level, as you can imagine. We have a key focus in working with organisations who share our priorities on safety, aligning with customer outcomes through mutual feedback and continuous improvement, resulting in excellent performance on our projects. Our onboarding process encourages collaboration and innovation with monitored outcomes of consolidating spend to ensure we focus on the strongest relationships. We work to identify challenges facing our suppliers to make an effort to support them. We communicate our approach to sustainability and help our suppliers to see the long-term goals and support them to achieve them. We'll be especially looking to talk to organisations who can support our technology across the life of the hospital as we maintain it over the long term. These particular skills we develop through graduate programs and continuing development. We'll also collaborate with local subcontractors to support installation and asset management, and this will include social enterprise and Aboriginal-owned business. As you can see from this next slide, our experience is broad across not only Australia and New Zealand, but globally in healthcare. And two of the most important and great examples of what we've done are basically in two significant hospitals that you may well be aware of: Fiona Stanley Hospital in Western Australia and the Royal Hobart Hospital in Tasmania. At Royal Hobart, a unique intercom solution was required for the infectious control rooms to allow communication within the rooms. So a world-first solution was designed in a collaboration with the key vendor to meet the demanding requirement that eliminated spaces where bacteria could grow. It was seamlessly integrated into the security system and still operates today. At Fiona Stanley Hospital, we had an innovative solution around our command wall, as it was the first in Australia to support that. And basically it tracks and traces individuals through the building and beyond, giving control of cameras and doors from a single control point. This is shown to offer a new level of protection to both staff and patients alike. These two examples really do support the notion that Honeywell and our new suppliers working together can make a difference. If you can have an interest in working with us, then please feel free to contact us after this presentation this afternoon. Thank you very much for listening, and thanks for your time.
Thanks, Chris, for that information on your important role within hospitals and other facilities. I would now like to introduce Bren Gray from Compass Group and Foodbuy to provide some further information on the supply of ongoing services to the hospital.
Hi, my name is Bren Gray. I'm the General Manager here at Compass Group Australia, Head of Procurement, and also General Manager at Foodbuy Australia, Compass's dedicated supply chain and procurement subsidiary. We are operating in approximately 45 countries around the world at 55,000 client locations and employ around 600,000 staff internationally, serving 5.5 billion meals per year. Domestically, our business turns over about $1.4 billion in Australian dollars annually, and we've been operating in Australia for about 40 years. We have 11,000 staff domestically across approximately 500 client locations. Those locations operate under a series of Compass Group brands, including Urest, Restaurant Associates, Delta FM, Omega, Chartwells, ESS, and Medirest. We are a founding member of Supply Nation, and we've been recently successful on the new Footscray Hospital PPP in demonstrating our capability across Victoria. As the leading international food and support services provider, the business has approximately £25 billion, UK pounds, in annual revenue, employing over 500,000 people globally. The proven capability that we have demonstrated in previous bids of this nature would be delivering services to the 11 hospitals that we operate in across Australia and demonstrating a scalable business model to be able to deliver on the Frankston Hospital as well as additional services through the PPP term. As a global business, we will always leverage our global experience, innovation, and local lessons learned across the healthcare industry to deliver on the state's objectives. And we've demonstrated this on previous tenders. Having partnered successfully with Honeywell for the recent Footscray Hospital PPP, the Mater Hospital in Newcastle and the Long Bay Forensic Health Hospital, we're now putting our best foot forward for Frankston. And we have a strong health team in the MediRest sector that delivers services to 11 hospitals across Australia with a proven corporate model for key functions including human resources, finance, safety, as well as the dedicated procurement function that sits within Foodbuy. We have a scalable business model that is able to deliver on the Frankston Hospital and additional services piece through the PPP term. That global experience, innovation and local lessons learned across the healthcare industry continue to deliver on the state's objectives. So the scope of the services being presented today cover soft FM, including security services, the cleaning services, grounds and maintenance services, pest control services and waste management. These are demonstrable across Newcastle Mater, Long Bay Forensics, Queensland Children's Hospital and the University of Canberra Hospital PPP. So what makes us different? The standalone supply chain function is wholly in-house. Foodbuy is a wholly owned subsidiary and a dedicated resource as the standalone supply chain and procurement function for Compass Group Australia. That dedicated resource is spanned across our national business, so based in every Compass Group office, and as a team of about 50 people dedicated to supplier onboarding, vendor quality assurance programs, governance and oversight to the supply chain, and the expenditure of the Compass Group business holistically. As a team, we're committed to supplier diversity. We've set ourselves targets and exceeded those targets across Indigenous employment and business engagement, as well as previously, as I mentioned, being founding members of the Supply Nation business. Our standards and our values are something that we're super proud of. We demonstrate them front and center on our website, as well as having access to our Elevate Reconciliation Action Plan. We have a number of programs that span supplier diversity, Indigenous employment, joint ventures, ethical programs in animal welfare. We have a World First program which demonstrates all of our sustainability commitments and goes through those in some detail. And we're signatories to the Business Council of Australia SME Supplier Payment Code. Additional information with regards to how we engage and what our programs are across the Foodbuy network are available on the website, either through Compass Group website or Foodbuy directly. And that includes the local content engagement page where vendors can become registered on the Foodbuy platform through an automatic registration program. And through that program, they are able to register interest in supplying any Compass Group site in any site around the country. And the assignment of those supplier categories ensure that those vendors get invited to participate in RFIs, RFQs, or just general inquiries that we might seek from the market from time to time.
Thank you, Bren. And often the contracts that are not so visible are those associated with the ongoing running of the hospital, so some great opportunities in that space going into the future. The slides that follow will cover ICN's credentials, our role and how that relates to the local jobs first policy and social procurement framework, our industry engagement initiatives, and how you can connect to Exemplar Health through ICN Gateway and our industry advisor. ICN Victoria has been working for local industry since 1984, founded on the noble principle that local SMEs should be given full and fair opportunities to compete for work on major projects aided by local content considerations. The numbers presented here in the last financial year are a great visual representation of the big build that's currently underway and the commitment to local participation. Storytelling is part of what we do, and the best stories are told from the vantage point of experience, passion, knowledge, and expertise. Our team delights in supporting and connecting local industry, being champions of local capability and inclusion, and assisting with project procurement process. We elevate the great stories of Victorian resilience, manufacturing, innovation, infrastructure, and social and sustainable outcomes through various digital channels, briefings such as this one, site visits, and much more. Complementing this work are our systems. At any one time, ICN Gateway, which is our supplier and project database, has approximately 19,000 registered businesses in Victoria and around $400 billion worth of projects listed nationally. And then there is also VMC that is crucial in supporting the tendering phase for agencies, the submission of local industry development plans for bidders, and the reporting for agencies, lead contractors, and the supply chain. We're proud of our work, and it makes a difference by stimulating employment and local industry engagement in Victoria and Australia. Local Jobs First is about creating local jobs and opportunities for Victorian businesses and workers whilst achieving value for money. It also focuses on sustained skills development, and we administer the policy on behalf of the Victorian Government. Through this policy, Victoria has a strong mandate to drive local jobs and capability for government-funded projects and supported major projects. These statistics from Local Jobs First annual report show how effective this policy has been. Our role in this policy could not be more important as Australia recovers from the effect of COVID-19, and the desire for sovereign capability has never been stronger. We have enjoyed getting out and about in the high vis recently this year with meetings in industry. It's fair to say that our industry advisors were champing at the bit once restrictions were eased. However, that's been tempered slightly of recent weeks. But here are a few happy snaps from recent industry visits in Ballarat and Gippsland, as well as events in Geelong and Seymour. Our team of 10 highly skilled and motivated industry advisors situated across the state are passionate advocates for local industry. It is this passion and knowledge that underpins our initiatives to connect and provide local solutions. As mentioned previously, ICN Gateway is our national opportunities portal. It is where you will find information on the Exemplar Health Frankston Hospital redevelopment bid and where you can submit an expression of interest to Exemplar Health directly. You will need to be registered with us to submit an EOI. A basic registration is free. And if you are already registered with us, that's fantastic. Please ensure that your company profile is up to date, including all the relevant contact details as well as your capability are noted. Please also ensure that you have the email notification options ticked on to receive all relevant communications. Our friendly client services team, headlined by Tiana Gibson, are happy to help with any ICN Gateway questions that you may have. John Sands is the allocated industry advisor for Exemplar Health on this project, and his contact details are on the screen. And he will be happy to chat to you about connecting you with the bid team directly. Also listed here are the contact details for both Tiana and Brian as well. And apologies for the slight technical break there, but satellite seems to have gone past the Venus or Mars or whatever, and we lost a bit of a signal. But just a reminder to those who would like to participate in the online networking after the webinar, the link to that has been sent to you in the reminder email that you would have received prior to today's event. So that networking will start at 12 o'clock on the Hop-In platform, and we look forward to seeing as many people as we possibly can on that session. We've now got a few questions, so we're going to get into those pretty quickly. And if we don't get to yours today, we will get an answer to that and post the answers on the ICN Gateway page shortly. Just to note that Sean Kelly is representing Compass for the Q&A, and unfortunately Capella are not able to be there for the Q&A, but again, we'll answer questions post-event as necessary. So a couple of questions for Dim at Lendlease. Might do the first one and come back to the second one, but will there be a need for services such as underground service locating and service proving?
Short answer is yes. The site is a brownfield site. When I say the word brownfield, it's an existing hospital with a significant number of services below ground. We will need to identify all of those during both the initial groundworks, but also to understand where each of those services are. So yes, there will be.
Terrific. And another question, which seems to be a lot of interest in prefabrication over the last year or so, and is there a bit of a focus on prefabrication for this particular project, including services, for instance, where apparently modular wiring was used at Sunshine Coast, and also looking at modular medical head walls. Would that be considered for this particular project?
Again, answer is yes. We're always looking at modular options. Modular is an innovative approach that, look, for those who are familiar with it, obviously understand the benefits around safety, quality, and obviously speed of construction and being able to have a higher degree of certainty. So look, we're always looking for options around modular construction. We've done a fair bit of modular on some of our health projects in the past. And very keen and interested to hear if there are any new and innovative solutions to modular in the health sector.
Terrific. Thanks, Dim. And just a reminder, if you do have a question, to pop that into the platform under the raised hand icon. Sure, Dim, any comments around food service potentially on site, I guess, while construction's going ahead for people involved in the construction?
Yeah, thanks. I mean, as Sean mentioned, we will have a small need for food services during the construction process. One of the key things that we need to look at is the impacts of building such a large hospital within an existing hospital environment, and how we make sure that those operations do not impact Peninsula Health and the Frankston Hospital's ability to do what they do, which is provide high quality healthcare. So again, there are options there that we are looking at around the food service for the construction phase, but something that we haven't resolved yet. So again, keen to hear how we can potentially partner for those interested parties.
Sure, thanks for those answers. Again, Dim, back to you. I think on this one, based on underground asset service works, would NDE survey and geotech drilling be required along with waste control?
So I'm presuming that was NDD, so non-destructive digging. Yes, there will be a need for some non-destructive digging in and around some of those assets, and part of the service proving to find where those below ground assets are. The geotechnical design is something that we're still working through. But given the geotechnical nature of the site and what we do know about the development site around Frankston Hospital, it will have a significant response around the geotechnical and foundation design to deal with what is going to be quite a large volume and mass of building on that area of the Frankston Hospital site.
But that looks to be the end of the questions for the session. So look, appreciate those, and we will post the answers back on the gateway again, so that you've got full access to those. And just another reminder to join us for the online networking at 12 o'clock. That's again on the Hop-In platform, and the link was sent via the reminder email about today's event. So that's today's webinar concluded. Look forward to seeing you at the networking if you can come along to that. But big thank you to the ICN team for putting this together, in particular Jacob, Kate, John and Brian, and to Tiana has also stepped in at the last minute. Thanks to, and again, appreciation to all our presenters, to Sarah, Jackie, Dim, Chris and Bren, and to Sean for stepping in to do the Q&A as well. Much appreciated. And thanks to the Exemplar team for trusting ICN to run this briefing for you. And finally, thanks everybody for joining in. And again, apologies for the bit of satellite breakup there, but hopefully that didn't detract too much from the webinar itself. But hopefully we'll see you in the networking shortly. Enjoy the rest of your day and stay safe. Thank you.